Hey, it's Dr. Jaban. Today I'm talking about what makes for an active infection. So there is a lot of confusion out there and a lot of disagreement among doctors on whether or not you have an active infection in your body if you have antibodies related to it. So one of those examples is Epstein-Barr. Epstein-Barr, you can have all kinds of markers. You can look at the IgM marker, which is supposed to be, by medical standard, the active right now standard. And then you have 3, sometimes 4 different IgG markers, whether that be the nuclear antibody or otherwise, that might be way off the chart, but then you still have a negative. Now, let's look into some other types of infections, autoimmunities, food allergens, just to get a frame of reference here. So first of all, IgM, IgG, IgE, IgA, and D are all types of antibodies in the body that we are using in the body as the immune system. So they mean something. M is current active. E seems to be highly reactive and acute. G is more chronic, along with A being a bit more chronic also. So then if you have autoimmunity, so you have Hashimoto's, lupus, or otherwise, they're testing for IgG a lot of times with their testing. And if it's positive, then you have that autoimmunity, or you potentially have that autoimmunity because you're creating those antibodies right now in the moment toward that tissue type that the antibody is going toward. So that means you're autoimmune. But if you have IgG toward a food, that means that your body is reacting to it, and it's reacting to it recently, as in at least the last 9 months, but in some studies, 6 months. Now, there's definitely some disagreement on whether IgG for food is completely accurate. Part of the reason why I don't find that to be completely accurate is not because I don't like to use those tests. It's because IgG towards food, or even immunoglobulin tests toward food of any kind, are going to be affected by the infections in your digestive tract, the fungus, and otherwise. But that's not the topic we're talking about today. So then when it goes to infections, if you have IgG positive, then it's a past infection that you could have had even as a child, is what the standard is saying. Now, if you're listening to this and you're getting a little confused because if you have an autoimmunity, it's active now. If you have a food, it's active in the last 6 months. And if you have an infection, it's active in your entire lifetime. That's where that confusion comes in. So my personal opinion, working with chronic illness patients every single day, is this. If you have IgG that's positive, then that means that at some point your body has seen that infection. If IgM is negative, that means it's likely not acute, so you didn't get it in the last month. However, that doesn't mean that you don't have it still in a chronic state. Because remember, when you're working with doctors out there, a lot of them don't even believe chronic Lyme, mycoplasma, strep, or any other infection can be chronic. It's not something that's available or out there to us to, in Western medicine, believe. So chronic Lyme isn't a thing, which means that Pans and Pandas, chronic strep infection, isn't a thing. Chronic Epstein-Barr infection isn't a thing. Chronic parasites or parasitic infection in the United States isn't a thing. We all know that's not true, but what we do know is that on the labs, depending upon where your IgG is, can tell us how strong that infection may be, how recent it may be, just based off your ability to interpret it. So if you come back with an Epstein-Barr virus at 750 with a greater than sign that says it's off the chart, I'm likely going to tell you that you're dealing with a chronic Epstein-Barr infection. Now, that doesn't mean that it's new. It could have been there for the last decade, and maybe your symptoms are only 5 years old. So then that might not be the root cause of what's causing your problems or your symptoms, but it's there. If you have a positive Babesia marker that shows that it's pretty elevated, that's IgM, you've got it, it was recent. If it's IgG only, you may have it still going on. It might not, again, be the active infection that's causing your health to degrade, but you have had it in your body, and likely it's still moving around, because if your body's creating antibodies to it, it's had some interaction with it typically in the last 9 months. Where does that research come from? That comes from more of the food allergen side of things. So on the food allergen side of things, if you don't eat a food for 9 months straight, it's likely to go negative in the body. So that's what that piece is about. And the next piece is when you're looking at it from an autoimmune perspective. When you look at it from the autoimmune perspective, you look at the, say, Hashimoto's antibodies. They'll go up and down based off of the amount of attack in your body on the thyroid. So it's measured and monitored so that if it's higher, then you're having a recent attack, and if it's lower, it's older. So when I work with people, I have seen those numbers change every 3 months pretty rapidly at big chunks, and then it associates with symptoms. So do IgGs tell us that something's happening? Absolutely. So if you have a positive IgG reaction in your body, that means that at some point in the last 9 months, you're dealing with it. So another question was raised, what about early antigen? Early antigen just means that that's earlier in the process. Again, it's not as early potentially as IgM because that's acute, but IgG early means earlier in its process. So I drew a little bit of this out today when I was working with a patient on food allergies. And what happens is if you have an IgG reaction, it's chronic, it's long term. So it takes a while for it to ramp up. Whereas IgE might ramp up with a big spike, you have an anaphylactic reaction, your throat closes, and then it drops. So that's more toward food. So if you can take that information and extrapolate it out over all the different reasons why you'd have IgG, that's going to tell you a bit more about what's going on in your body with these infections. If it's acute and early, it's going to be happening quickly. And that's going to show you an E or an M reaction. If it's long term, it's going to react more slowly, and it's going to also be an A or a G. So when people come in and they say, I don't know what foods are affecting me, it seems like 3-4 days later, maybe something's affecting me from what I've done, that's more of a G or an A reaction. So that's what I was trying to get to, is it might ramp up slowly. Whereas if you get food poisoning or anaphylaxis or throat closing, it happens immediately, and you're likely to see the M or the E type reactions in your body. All right, so that's my little talk on what some of these lab tests are looking for and how you can help yourself to interpret them a little bit better, because right now mainstream medicine is still stuck in the acute phase model, meaning we're looking for things that are very acute when we're looking at tests, and if it's not acute, then, well, it's in the past, and there's no such thing as past infections affecting the body now. That's not the truth, but that is what it's looked at as right now. Hope this helped everybody.